I'm Dr. Jason Reynolds from Paradigm Performance Chiropractic. We're here with Joseph Crash, the pitcher for Penn State University. We're just going to be talking a little bit today about maintenance care in an in-season program. I'm not going to talk much about rehabilitation, sports performance, or any type of diagnosis, just mainly on type of passive care treatments that should be done and can be done with pitchers in season. So we're going to look at the shoulder and the elbow for overhead athletes, obviously pitchers. The main thing we want to be looking at here is the rotator cuff, the capsule of the glenoid, and also making sure that we have proper scapular stabilization. Those are the goals when we're treating our overhead athletes, considering the glenohumeral and scapular biomechanics. Other considerations are down at the elbow, mainly the medial collateral ligament and the stress that will take through the season. So we'll just go through some typical treatments as far as soft tissue mobilizations and joint mobilization to keep them healthy during the season. So typically what we'll do is we're going to work the whole shoulder complex. In overhead athletes, there's a tendency to get a tight posterior hip capsule associated with the repetitive movement. But we'll also work through all the rotator cuff musculature because obviously that undergoes a lot of repetitive stress. And then down at the elbow, working on biceps, medial triceps, and wrist flexors. Okay, so let me just go ahead and grab. So like we were saying, with maintenance care with the shoulder, we want to work the whole complex. Okay, overhead athletes, repetitive stress, we want to make sure there's no adhesions or restrictions in any of the muscles, rotator cuff and associated. So sideline position is actually the best position to work on the shoulder. You can get to all of the diathorial ranges of motion. Okay, you can get into abduction, extension, both internal and external rotation. Be able to work both anterior and posterior aspects of the shoulder girdle here. Okay, so typically you can just start with some myofascial release technique. Okay, so make sure you use a little bit of lotion. You want too much. You want enough for a little bit of skin drag. Okay, so we can work in the front here, pec minor. So coming straight back. Right over the coracoid here. Okay, typically do some clavicular division, pec major. Okay, so again, this is all passive ranges at first. You okay there, Jeff?
Yep.
Okay, I'm going to hit some sternal division fibers.
Go.
Okay, so then just working through the sternal division of pec fibers here. Okay, that'll take care of the anterior portion. Okay, then we can work into the biceps muscle. Okay, a lot of times with overuse injury, you can start getting that subacromial impingement, that classic impingement syndrome. Alright, so we just want to make sure there's no adhesions here in the bicep. So again, just a few passive passes through the musculature. Okay. It can work in through the three heads of the deltoid. Alright, so just starting in its abducted position. Again, all of our soft tissue mobilization is guided by the palpation findings that we have. Alright, so some musculature in certain athletes are going to be tighter, more restricted, have more adhesions. So obviously we'll spend more time on certain areas of the shoulder girdle. Then we'll get to the posterior aspect, the GH. Okay, so working through supraspinatus, infraspinatus, teres major minor, isthmus dorsi, and then a move for the subscap. Okay, so starting here, just doing some punching movement here for infraspinatus. Okay. Work teres minor a little bit. Just changing the angle. Doing okay there, Joe?
Mm-hmm.
Okay. Working down into the lat. motion here. Up onto supraspinatus. And anywhere from 5 to 10 passes, depending on the adhesions that we're finding, is going to be appropriate for the soft tissue mobilization. Okay. I'll show you the subscat move here in a second. A lot of the treatment we do, we like to use instrument-assisted soft tissue. Okay, there's all types of tools out there that you can use. In our office, we use Graston technique. So that's these tools here. And again, with Graston technique and any other type of soft tissue instrument-assisted work, we're looking at breaking up any scar tissue if there is from post-op, maybe from a previous strain. We're also looking at very superficial layers of the fascia that can get restricted, which can limit range of motion. Okay, so again, with the Graston, we're going to be more specific to areas that we've diagnosed through palpation as to where restrictions are. But in general, we'll just put the muscle in lengthened position. Okay, so if I'm working on the pec here, there's all different techniques we can use, but in general, we're doing sweeping, scanning. Again, we will have diagnosed what exactly we're trying to free up. Okay, and then we can go through ranges of motion like we were just doing. So again, just for example, on the deltoid, if we found some restrictions, start in that abducted position, taking it through a range of motion as we're doing the Graston technique. Okay, so this is just a concept that can be applied for each individual athlete. You're going to have different things you're working with. So again, proper diagnosis is the key here. Then a move that you can do here for the subscap. This is really good for just scapulothoracic mobilization, as well as getting up onto the subscap, releasing any adhesions that could potentially be in there. Just put the patient's arm here in the back, hook up underneath. You can use your chest to push the GH medially. That helps bring the scap up off the back, and then you can do just some scapulothoracic mobilization and some myofascial Grastoning here of the subscap. You doing okay there?
Mm-hmm.
Okay. Let me have you sit up, Joe, please. And the last thing we'll do, after we've done our soft tissue mobilization, we'll have went through, done some Graston technique. Typically now that the tissue has been formed, so to speak, now we want to take his shoulder and his scap through some ranges of motion to help solidify the changes that we've made passively. Okay, so for overhead athlete, we just want to check just general range of motion. You know, scaption, flexion, coming out here into pure abduction, even some external, internal rotation. Again, varying ranges of motion will be restricted depending on the athlete you're working with. But then we'll just take through some scapular-assisted ranges of motion. So for Joe here, he's doing pretty good. He's a pretty regular patient. But this pure abduction, there's a little bit of range of motion lag that we can feel. So we'll just do some pure abduction, scapular-assisted range of motion stuff. So Joe, you just go ahead and just going to raise your arm up here. Okay, go ahead. So all I'm doing here is active assisted. I'm palming his scapula back here, just assisting it in its upward rotation. And again, this is just mobilization with movement. Okay, just assisting in that abduction. So the treatment you just saw is a typical in-season passive care protocol utilizing soft tissue mobilization and Graston technique. It's a great way to keep your overhead athletes healthy during the season. It's not just specifically for baseball, but other athletes that use overhead throwing motion, volleyball, water polo, quarterback. Again, it's a great way to keep an athlete healthy while they're in season. If you want more information, about this type of care, you can check out www.paradigmdoc.com, or I encourage you to find a specialist in your area that does specific tissue work.